Rahnwet na.
Rahnwet. Rahnwet.
Yes, tira orang lapakan, misalkan sum ang kabese yung
Rahnwet na.
Rahnwet.
Hello, Kasaledye. Welcome to Rahnwet Bay, a weekly radio program that usually informs the general public about the upcoming important events and ongoing activities in the state of Bay. Today, we are fortunate to welcome Dr. Momoy, Liaison Officer, and Mr. Simonson Ebel, Health System Coordinator from WHO, will be our guest in today's radio program. Welcome.
Thank you, Casalelia and Ms. Calio. Thank you again for giving us the opportunity to talk at the Pohnpei Public Broadcasting Corporation. We are very happy to be here with you today.
Thank you. Please tell us, what is WHO?
Okay, so WHO stands for World Health Organization, and we are one of the specialized agency of the United Nations UN family. So WHO is the lead agency for public health, and then we were established in 1948, April 7th. So this day is celebrated as World Health Day every year with the different themes. And our goal is to ensure the highest attainable level of health for all people. So WHO has a headquarters in Geneva, Switzerland. We have 6 regional offices and about 150 country offices. So our office in FSM is one of them. And then FSM belongs to the Western Pacific region, and our regional office is in Manila, Philippines. We also have a small sub-office in Suva, Fiji, to provide us support. So globally, about 8,000 staff and employees are working for WHO, and more than half of us are working at the country level. So while most of the national staff continue to work in their home countries, a lot of international staff, like myself, move from one duty station to another every few or several years. So for myself, I started my first job with WHO in the headquarters in Geneva more than 20 years ago. Then worked at all 3 levels, including the regional office in Manila and 3 other country offices in Bangladesh, Cambodia, and Vietnam. So I came to FSM about a year ago, and this is my first time living and working in a Pacific Island country, and I'm very much living my new experience working and living here.
Thank you. What does your agency do in the FSM?
So our office, as I said, in FSM is called WHO Office for Northern Micronesia. That means we are supporting 3 countries, including FSM, Marshall Islands, and Palau. We are a small team, about 10 people, 6 in Palikir, Pohnpei, 1 in Chuuk, 3 in Palau, and 1 in Marshall Islands. So we have an office within the government building, Department of Health and Social Affairs in Palikir, and we work very closely with the government every day. So WHO work with the government to, for example, develop policy or plan some program, implement activities in different areas, including like health emergency, which is like COVID-19, we have been experienced, other communicable disease, such as tuberculosis, measles, or non-communicable disease, such as, for example, the cancer, diabetes, or environmental health, such as impact of climate change on health. And also as a cross-cutting work, we support health policy development or strengthen health services. And then we also support many activities to prevent people from health risk, such as smoking, obesity, alcohol, and also promote healthier lifestyle. Especially we are working on the life course approach. Recently, we work beyond the health sector. So recently we started a new initiative to promote school health in Chuuk, in close partnership with the Department of Education as well. So our aim is to support FSM to achieve universal health coverage. That means everybody has access to needed quality care without suffering financial hardship.
Thank you. What kind of jobs do people have at your agency?
Thank you. So you may think only health professionals like doctors or nurses are working WHO, but it's not necessarily true. So we have some position for medical officers. This is for the medical doctors, but many of our experts are technical officers whose background are quite diverse. For example, of course, many of us study public health, or nursing, epidemiology, pharmaceutical, laboratory, health economics, health information, statistics. It's quite diverse. Law, environmental health, gender, so on. So we need all of these expertise in the multidisciplinary areas to improve health of people. Also myself is not a medical doctor. My degree in health science and health policy and services. So I often encourage young people to explore jobs at WHO even if they are not medical doctors. And we really need people from these diverse backgrounds as health is such a complex issue and affected by many socioeconomic factors in the societies. Also in addition, there are other kinds of jobs in WHO such as program budget management, admin, finance, human resources, logistics, as in any other companies or organization. These jobs are also essential for WHO to function and operate their daily business. So it is also a way for young people here to contribute to the mission of WHO. And also I would like to add that there are many different types of contracts with WHO. Some position long-term, some are shorter term, like short-term consultant focusing on some project. I'm here with my colleague Simonson here, who has worked for more than several years, and I'm learning from these national staff a lot because they know that the culture and also the tradition and context of the countries I work. So these are very essential assets for our country offices.
Kasi dia ancumalat sebagai sahabat, naimin ponte o itatau kaya tapi di WHO office lele sompat lemau, iuya health system coordinator kalahan.
Kalangan, thank you, Dr. Momo and Mr. Ebel. Last question in this radio program: if I wanted to work there, WHO, what should I study?
Okay, so as I mentioned, there are diversified jobs and opportunity within the WHO because we need both health and non-health professionals and people who work in general services also to support our daily operation. So all of us work together as one team to support the countries to achieve, their health priorities. I think most important thing for young people is to find yourself a passion and motivation that you want to join that kind of team. And then they can, think how they can specifically contribute to the mission. That means, of what will be your area of expertise in joining this journey. But of course, if they're interested in work of WHO in general, studying some subject like public health will be always very beneficial. So we also have a different internship and volunteer programs so that young people can just experience what is the work of WHO and then understand the work of the WHO, the UN. I had a recent opportunity to go to a college of Micronesia and talk to some of the students there. And then I was very happy that many students came forward after our talk and they showed interest in knowing more about the work of WHO and even offering for their time for internship. Actually, this year for our first time, we are also planning to recruit one of these, one or two, as a UN volunteer, United Nations volunteer. And we are very excited to have these young people joining our team. And then also we have some scholarship program called fellowship. Maybe my colleague Simonson can also explain about it.
Yes, okay. Our office also provide scholarship we call it the WHO Fellowship for Young Students that want to continue their education in the area of health, nursing, and public health. So, and also, if you notice, the UN offices are increasing, not just in FSM, but also in Arabayan and Palau. So there will be more opportunities opening up for the youth in the near future. Thank you.
Thank you, Dr. Momo and Mr. Eben. This concludes today's radio program, and you're listening to Rahnwet Nantonpe, a weekly radio program that informs the general public about upcoming important events and ongoing activities in the state of Pohnpei. Kalangan, thank you for tuning in. Kasalelye.
Rahnwet na.
Pohnpei. Pohnpei. Pohnpei.
Yet ire oralapakan misalkan sum ang KBC yung
Rahnwet na.
Pohnpei.